Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on epistaxis, which is nasal bleed. So let us discuss what it is. As you know that epistaxis comes from the Greek word epistizine, which means bleed from the nose, and is a combination of the two words. Epi means upon, in addition, and stizine means to drip. What does epistaxis mean? Epistaxis, also called as nosebleed, or it refers to a minor bleeding from the blood vessels of the nose. Epistaxis is a commonly found complaint, especially in the field of emergency medicine related to the treatment of ear, nose, and throat (ENT) conditions. Epistaxis more commonly occur in children ages 2 to 10 years and older adults ages between 50 and 80 years. There are two types of epistaxis depending on their origin: anterior and posterior epistaxis. What is anterior epistaxis? Anterior epistaxis refers to a nosebleed that originates from the anterior frontal part of the nose. Most of the time, cases of anterior epistaxis originate from the Kieselbalch plexus, which is a vascular network found on the nasal septum. As these arteries can be easily traumatized, anterior epistaxis is the most common type of nosebleed and usually involves one nostril. What is the posterior epistaxis? Posterior epistaxis refers to the bleeding from the posterior or superior nasal cavity. Most often it originates from the Woodruff plexus, which is a vascular network found in the lateral wall of the nasal cavity, and posterior epistaxis usually involves both nostrils. For these types of nosebleed, the blood may also flow backwards and uncomfortably get swallowed or curved up hemoptysis. Often diagnosis of posterior epistaxis occurs after failing to manage an anterior epistaxis or noticing bleeding into the posterior pharynx or throat. It is often harder for healthcare professionals to visualize the source of a posterior bleeding in a physical examination. Thus, a nasal endoscopy is often performed by a clinician to help identify the origin of the bleed. What causes epistaxis? There may be local trauma or anatomical irregularities, inflammation in the nose. Sometimes there may be rare tumors in the nose or topical nasal sprays, incorrect use or excessive use of nasal sprays, decongestants can cause, and sometimes facial trauma or a fist trauma on the face can hit by some object can cause nasal bleed. Epistaxis generally occurs due to the rupture of blood vessels in the nasal mucosa. This rupture can be triggered by local or systemic causes, environmental factors, or medications. Local causes of the epistaxis can include local trauma caused by nose picking, a foreign body in the nose, anatomic irregularities such as deviated nasal septum, facial trauma, incorrect or excessive use of topical nasal sprays, inflammatory reactions, and rarely intranasal tumors. Smoking and snorting illicit drugs such as cocaine can also cause frequent nosebleeds due to irritation of the nasal mucosa and can lead to further nasal damage in some cases. Then there is systemic causes. Some systemic conditions that increase the risk of epistaxis include high blood pressure, hypertension, vascular malformations, cardiovascular diseases, and bleedings. Disorders like von Willebrand disease and hemophilia A and type B. Additionally, heavy alcohol use can also increase the risk for epistaxis since it disrupts normal blood clotting activity and dilates superficial blood vessels, which increases the risk of a rupture. Then environmental factors. Common environmental causes of epistaxis include changes in the temperature or humidity, and nose vessels are more prone to rupture in cold weather and dry environment. Additional environmental factors can trigger allergies. Allergies can increase the risk of epistaxis for multiple reasons. Not only can allergic inflammatory reactions itself increase the risk, but excessive nose blowing and the use of allergy medications that dry the nasal mucosa, for instance, decongestants and antihistamines, can further compound the risk of developing a nosebleed. Then some medications can predispose individuals to epistaxis. This is especially true for blood thinners such as warfarin, which can interfere with the blood clotting, and anticoagulants such as warfarin, antiplatelet aggregation inhibitors, NSAIDs, aspirin, and ibuprofen, as well as homeopathic medication that prolong the bleeding like ginseng and vitamin E, can all increase the risk of epistaxis. How do you treat epistaxis at home? Pinch tip of the nose with 2 fingers for 15 to 20 minutes. Or sit up slightly, lean forward and tilt head forward. And If bleeding continues, then you can use topical nasal sprays, vasoconstrictive sprays, local anesthetic sprays, and in case of recurrent episodes, non-stop bleeding, you in the hospital setting treatment, we can give you the nasal packing, insert gauze like material or nasal tampon in nasal cavity. If medication doesn't work, then posterior epistaxis might be the cause. So vasoconstrictive agents can be used and local anesthetics can be used. Management of epistaxis based on the severity of the bleeding and the individual's accompanying medical condition. Treating minor nosebleeds can often be managed at home with simple first aid measures. If needed, the course of treatment can progress to visiting a physician or the emergency room. In more serious or recurrent cases, surgical intervention may be required. Anterior epistaxis is usually the easiest to manage. Posterior epistaxis is more likely to require medical attention since it is more difficult to control and may compromise the airways or cause aspiration. How to treat epistaxis at home? Most often, treatment of epistaxis can be performed at home or by primary care physician. The first step to stop a nosebleed is apply direct pressure by pinching the tip of the nose using the two fingers for 15 to 20 minutes. You can help prevent blood from reaching the throat by sitting up straight, slightly leaning forward and tilting your head a little forward. These measures are usually enough to stop a nosebleed. But if bleeding persists, topical sprays containing vasoconstrictive medications or local anesthetics can help too. If the nosebleed is severe, extended causes difficulty breathing, makes you vomit due to swallowing a large amount of blood, was used by a serious traumatic injury, or if a child under 2 years of age has a nosebleed, go to the nearest emergency room and seek for attention from medical professionals. How is epistaxis managed in the hospital setting? You should contact your general practitioner or go to the medical center for special cases. For instance, if you have recurrent episodes or if the bleeding does not stop, especially if you have bleeding disorders or you are taking blood thinners, simple medications used for treatment includes topical vasoconstrictive nasal spray such as epinephrine, oxymetazolines, local anesthetics. If this does not work, or if you have a posterior epistaxis, posterior or anterior nasal packing is used. Nasal packing involves inserting a gauze-like material, nasal tampon, into the nasal cavity to absorb the blood and provide pressure to the affected area. Infectious complications arising from the nasal packings are uncommon and usually local. Rhinosinusitis can develop but usually spontaneously heals after packing removal or a short course of antibiotics. Other bacterial systemic infections like toxic shock syndromes can occur. Toxic shock syndrome is treated by immediate removal of the nasal packing and any infected or necrotic tissue, as well as antibiotic therapy following a nasal culture. Recurrent or persistent anterior epistaxis may need cauterization. Chemical cauterization, usually a silver nitrate swab, should be tried before more advanced electrocautery is used. In any case, this is done only on one side of the nasal septum in order to avoid perforation. How do you prevent epistaxis? There are a few tips you can use to prevent nosebleed. First, avoid noise picking as such as possible and try to keep your fingernails short. Try to not blow your nose too often and only gently when you do, especially in winter time and during allergy season. If you are taking cold or allergy medications, make sure you follow the instructions that come with the package. Next, if you are taking part in any activities that can endanger the nose and head, make sure to wear proper protective headgear. Lastly, avoid excessive alcohol drinking and smoking. So it was all about the nasal bleed or epistaxis, and I hope so that you would have liked this topic. And if you have liked this topic, then kindly share this video with other individuals as well, and don't forget to subscribe my channel. And if you have liked this video, and if you have liked and if you have watched this video, then thank you very much for listening this video. Have a wonderful nice day. Thank you very much.